Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. You are watching the Knee to Know Show. In this episode, we're going to talk about ways to improve your comfort and safety with going up and down the steps, utilizing your surgical leg after knee replacement surgery. Hi everyone, so in yesterday's video we talked about the rule of up with the good, down with the bad for going up and down steps in that acute phase after surgery. As you're rehabbing, as you're recovering, you have a lot of pain, a lot of swelling, stiffness, muscle weakness after your surgery. So we kind of utilize this strategy, the up with the good, down with the bad, to help you effectively and safely go up and down steps. Now, eventually, you're going to want to be able to go up and down the steps utilizing your surgical leg and being able to do so either step over step or at least in a way that is comfortable and safe and manageable. So what do we have to do to get to that point where you're comfortable and okay using that surgical leg to go up and down steps with little pain, little discomfort, and safely as well? So the main things is, first we want to address the impairments, the things going on with the leg in general. So, this means your range of motion. So you need a certain amount of range of motion to go up and down the steps. I think it's a little over 100, maybe 110 or so to comfortably go up and down stairs. So you want to work on that range of motion of the knee, as always, that bending and straightening. You want to work on your strength, so strengthening those quadricep muscles especially, and the muscles of your hips, your glutes. Those are going to be the muscles that are going to help you push up and into that standing position. And you're just going to want to work on your balance, your stability, all those good things. So how do we do that? Well, the main thing is focus on exercises that are similar to what you want to do. So one thing you can do is steps, step ups, or just going up and down stairs. So for example, just doing general step ups, maybe having one step, pushing up, and then coming back down. And this is great because it's going to build that strength in your quadriceps, build that strength in your glutes, as well as work on your stability and balance with this activity. Now, you might get sick of doing step ups all the time, so you can also do all sorts of body weight activities. You can do body weight squats, you can do sit to stands, you can do split squats or lunges up and down. Do the other side. You can do these goblet squats or these wide stance squats. All of these exercises are going to, one, they're going to mimic very similar motions, especially with the legs, the pushing up, using your quadriceps of your thigh, using your glutes, your hamstrings. They're going to mimic those motions, they're going to build strength, they're going to build stability. And those are all great exercises to do. Now, a big thing is the going up seems to come a lot easier and a lot faster than going down the stairs. And the reason for this is when you go down the steps, what you need is called eccentric control. It's an eccentric motion, which means basically as you come down, this leg that's standing still on the step, the muscles of this leg have to be able to control your body as you come down the step. So obviously we don't just want to flop down and fly down, because then you're going to fall down the steps and that's going to cause a lot of problems. You want to be able to go down the step nice and slow and controlled and come to the next thing. And that's called an eccentric movement, controlling your body's movement against gravity. Eccentric movements tend to require a lot more strength, a lot more muscle activation, and a lot more coordination and stability to perform. So that's why they tend to come back a little bit slower, a little bit more difficult to get to that point to do them comfortably. Some things you can do Again, focus on exercises and movements that are very similar. One of the things that I like to do are, I call them step downs. So you can do lateral step downs out to the side. Now this one, usually I'll start with a step, an exercise step that's a little bit lower, and then start to build up as you gain comfort. But as you notice, as you're coming down, you're really focusing on that eccentric motion, that downward portion of the motion. And you would do it on both sides. Again, also to mimic what a real step would be going forward, you can do forward step downs eccentrically. Really focus on going slow and controlled down in the motion. You're going to notice that this is a really challenging activity for a lot of you, especially early on. So again, just focusing on that eccentric movement. Now you can also, if that's a little too intensive, a little too difficult, you can just do it on a flat surface, focus on eccentric motion. So for example, having a split squat stance and just focusing on going down nice and slow as far as you feel comfortable, and then coming back up. Down nice and slow, coming back up. And you can really even go much slower than I am. Go maybe try to focus on taking 3 or 5 seconds on the downward portion and then come up nice and quick. And what this is all doing, and you can do squats this way, down nice and slow, and then come back up. Down nice and slow, even slower than I just did, and then come back up. And what this is doing is, again, you're building that strength, you're building that stability, and you're also mimicking the muscle requirements, the muscle demands of that task of going up and down steps. So really, it's a matter of, as you build strength, both the concentric going up and the eccentric going down, you're going to build balance and stability with functional movements. You're going to build the range of motion in your knee to bend and straighten. As you build all those things up, and as you just practice the task itself of going up and down the steps, you're going to get more and more comfortable. It's going to become more and more easier to perform, and you'll hopefully eventually be back to doing that step over step, both going up the steps and down the steps. Take some time, take some training and patience and practice, but it's definitely possible to achieve. Thank you very much for watching, everyone, and take care.